everyone, it's Sarah with RegisteredNurseRN.com, and today I'm going to demonstrate how to check a blood pressure manually. First, you'll need to perform hand hygiene and gather your supplies. You'll need a stethoscope and a manual blood pressure cuff. So let's measure a blood pressure manually. To do that, we want to make sure our patient is sitting down with their arm at heart level and their legs are uncrossed. Now, if they're lying in bed, you would want to make sure that this arm is at heart level. Then what we're going to do is we are going to get our stethoscope and our blood pressure cuff. And you want to make sure you get the right size cuff for your patient's arm, because if you use too big of a cuff or too small of a cuff, it can throw off the reading. And what we're going to do is we're going to palpate the brachial artery, because this is the artery we're going to be listening to get our blood pressure, because we're going to be getting our systolic number, which is that top number, and this is the first sound we hear, and then our diastolic number, which is the bottom number, and this is the point where we no longer hear the sound. So whenever we're looking at the gauge of our blood pressure cuff, we want to make sure we're really noting those points, because it's going to tell us our systolic and diastolic number. So what we're going to do is we're going to put our cuff on our patient, and we want to make sure we find the brachial artery. This is the artery we palpate that we'll be using to determine our blood pressure. And it's found in the bend of the arm. So we're going to find it, and it is located here. And we're going to look on our cuff, and our cuff has these arrows. And because this is the left arm, we're going to make sure that this arrow is pointing in that direction of where that artery is. So you're going to put the cuff up about 2 inches above the bend of the arm. First, what we want to do is we want to estimate the systolic pressure. So we want to find that number. To do that, we're going to palpate the brachial artery, and we're going to inflate the cuff until I no longer feel the brachial artery. And at that point, when I no longer feel it, I need to make sure I'm looking at this gauge to know that number, because that number is our estimated systolic pressure number. Then when I go to take the blood pressure, I'm going to inflate the cuff 30 millimeters of mercury more than that estimated number. Now, the whole reason for doing that is because we want to avoid missing the oscillatory gap that can occur in some patients. Not all patients have it, but some. And it's usually patients with hypertension, because the oscillatory gap is like this abnormal silence that can occur, and it will throw off whenever you actually hear that first sound, which is your systolic number. So I'm inflating the cuff while feeling on the artery, and I'm going to note the point where I no longer feel the artery, which is about at the 100. Then I'm going to deflate it completely and wait about 30 to 60 seconds, and then we'll take the blood pressure. So our estimated systolic number is 100. Now I'm going to inflate the cuff to 130, and that will avoid missing the oscillatory gap if one was present. So I'm going to take my stethoscope, put it in my ears. You can use the bell or the diaphragm of your stethoscope. I like to use the bell because it's best at picking up low-pitched noises. So we're going to place that over the brachial artery. Do it lightly. Don't fully compress it, because you can occlude the artery. Then we're going to inflate our cuff to 130 millimeters of mercury. And we're going to let it fall about 2 millimeters of mercury per second. And we're listening for that first sound, which is our systolic number. Okay, it's 104. And we're listening for that last sound. And it was 78. So the blood pressure is 104 over 78. Then once you have your reading, make sure you fully deflate the cuff full of air, and you're going to take the cuff off of your patient, of course, and clean it if it's not disposable, and you will document the blood pressure and what arm you took it in. Now, what are normal blood pressure readings? According to the American College of Cardiology 2017 updated guidelines, a normal blood pressure is a systolic less than 120 and a diastolic less than 80. Elevated blood pressure would be considered a systolic of 120 to 129 and a diastolic less than 80. Hypertension stage 1 would be a systolic of 130 to 139 or a diastolic 80 to 89. And hypertension stage 2 would be a systolic greater than 140 and a diastolic greater than 90. Okay, so that is how to check a blood pressure manually. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.